This meeting is now being recorded.
Standardized examinations as predictors for NCLEX PN success. Standardized testing is used to compare individuals to the same standard and create equality in the testing process. Standardized testing began in 2200 BC in ancient China and continued until 1905 AD. The emperor would administer an examination to government officials every 3 years to determine fitness for office and retention of position. Standardized testing became commonplace in the United States when soldiers returning from World War II flooded campuses and were required to complete college entrance exams. Standardized examinations are increasingly being used as gatekeepers of professions that require a minimum score for certification or licensure. One example of this is the NCLEX PN. It must be passed by graduates of practical nursing programs to enter the profession of nursing. The NCLEX PN has been developed and maintained by the National Council of State Boards of Nursing, and it is used to license both practical and vocational nurses and registered nurses in all 50 states, the District of Columbia, and 8 United States territories. NCLEX tests applicants' knowledge, skills, ability, focusing on safe practice for entry-level nurses. State boards of nursing have regulatory authority over nursing education programs and provide a required criterion percentage pass rate for first-time test takers. The criterion percentage pass rate varies by jurisdiction, from a low of 70% to a high of 85%. Many states mandate that nursing schools meet the national average of 84.33%, or a percentage of that figure. Due to the importance of the NCLEX PN, it is crucial to determine the principal components that lead to success. The use of commercially available computer-based nursing examinations has been noted in the majority of the literature available. According to Moser, Williams, and Wood, 2006, the most widely used products in nursing education programs are the National League for Nursing Achievement Test, the Mosby Assess Test, Assessment Technologies Institute, and Health Education Systems Incorporated. Each product line provides nursing schools with specialty nursing examinations that are administered throughout the program, along with exit examinations. A correlation between standardized examinations and success on the NCLEX RN were noted in the literature, but the types of standardized examinations given were not consistent. The belief of being able to predict with some accuracy the students who would benefit from additional preparation is a vital goal of many nursing education programs. The problem statement. Nursing education programs are required by their state's Board of Nursing and accrediting bodies to maintain specified first attempt NCLEX pass rates that meet or exceed the national average to remain approved and accredited. The purpose of this retrospective correlational study was to determine if the PN Comprehensive Predictor Assessment Technologies Institute examination correlates to first attempt National Council Licensure Examination practical nurse success for practical nursing graduates of a large proprietary educational institution, 13 campuses. The research question, is there a relationship between results of the individual percentage score obtained from the PN Comprehensive Predictor Examination to first attempt NCLEX PN examination results for graduates from January 2010 through December 2012 at 13 campuses of a large proprietary educational institution where practical nursing programs are located? The conceptual framework includes classical test theory, item response theory, and Bloom's taxonomy for the cognitive domain. The public has placed trust in the professionals that are licensed in their field. The same trust is placed by the examinees on the development of the examination. The conceptual framework that influenced the development of the NCLEX, PN examination, and predictor examinations are the classical test theory, item response theory, and Bloom's. The commercially available predictive examinations offered by ATI have been developed using classical test theory and, to a lesser extent, item response theory. The NCLEX examination was developed using item response theory, focusing on the level of difficulty of each question for licensure decisions. With classical test theory, the final selection of items is dependent upon how each item contributes to the overall examination, while item response theory determines the contribution of each specific item. Classical test theory assumes that each examination score will contain a true and an observed score. Observed scores may contain errors due to testing environment, candidate well-being, or any number of distractions. The theory assumes that the errors are equally divided around the average, and the true score is the average score. Item response theory has become the preferred method of standardized testing in computer-based applications. This allows for test takers to complete different versions of examinations based on item difficulty. It focuses on the individual item to estimate the standard of errors rather than a single estimate of error for all test takers. The score is based on both the correctness of the response and the difficulty level of the question. Bloom's taxonomy for the cognitive domain ranges from simple to complex. There are 6 levels: knowledge, comprehension, application, analysis, synthesis, and evaluation. NCLEX and commercially available assessment examinations are written at the application or higher level. A full range of strategies have been implemented by nursing education programs to promote NCLEX success for first-time test takers. Remediation, tutoring, prediction, and progression policies have been used in various combinations with success by multiple programs, leading to increased first attempt pass rates. The literature reveals a wealth of information related to registered nursing education program strategies for NCLEX examination success. However, there is a gap in information related to practical nursing education programs and NCLEX success. Multifaceted approaches were identified in multiple studies reviewed. The majority of the studies have been completed due to the identified nursing programs' decrease in first attempt pass rates. The studies included multiple strategies. Morton determined evaluating the cumulative GPA and providing structured learning assistance workshops increased pass rates from 65 to 92%. Norton et al. Changed academic policy, implemented a newly designed remediation course, revised the curriculum, and implemented ATI content-specific examinations, the RN Comprehensive Predictor, and assessed potential risk status using the content-specific examination, and an increase in pass rates was noted. Davenport implemented the following strategies: content-specific computerized assessments, test-taking strategies, learning style inventory, test items that match the NCLEX RN format, requiring a set number of those practice items, sharing NCLEX RN resources, using study guides, promoting study groups, hosting a national review course, and using a checkoff form. Individualized plans and directions for students that did not meet the benchmark scores were also implemented. Many studies looked at possible predictors and various items were found. Frith, Seawick, and Clark found that the NLN achievement tests used at various points in the program were used to identify at-risk students and guide remediation plans and was statistically significant. Haas, Nugent, and Rule found that the cumulative GPA was a predictor. Those that successfully passed the NCLEX RN had a 0.3 point higher GPA than those that had failed. Daly, Kirkpatrick, Fraser, Chung, and Moser identified the final course grade in the senior level medical surgical course, and cumulative GPA were significantly correlated with success. Ukera, Magnumus, Atano, and Zhang identified significant correlation between nursing GPA and the final course grade in the fundamentals course with NCLEX RN success. Higgins found a relationship between grades in the two prerequisite biology courses, pre-admission scores in science courses, and the nursing skills course grade statistically significant. Sifford, McDaniel, Kuroff, Morrison, Free, and Newman also identified remediation based on the results of commercially available exit examination scores and increased NCLEX RN pass rates. The HESI exit exam is used by the majority of nursing education programs to predict success by setting a benchmark. Of the 6 longitudinal and serial studies that have been completed by Addison, Britt, Niebert, Young, and Adamson, Newman, Britt, and Launchner, Niebert and Young, Niebert, Young, and Britt, Morrison, Addison, Niebert, Hissa, found that a benchmark of 850 or above and limiting the examination to 1 attempt was the most reliable predictor. Though this study was evaluating the effectiveness of the ATI-PN comprehensive predictor, the findings for the HESI studies were very valuable. The PN comprehensive predictor, available from ATI, is an examination that provides a numeric value that indicates the likelihood of passing the NCLEX PN examination the first time and guides remediation. It is administered to students at or near the completion of the practical nursing program and provides a list of topics related to missed items and a numeric indication of NCLEX PN readiness. The PN comprehensive examination is a 180-item examination that assesses the student's comprehension and mastery of the basic principles of nursing. The percentage of questions from each major category aligns with the NCLEX PN client need categories blueprint. The literature identifies the various methods used but fails to specify which interventions result in an increase in the pass rate. It is important to note that there is a dearth of research related to the NCLEX PN. According to Creswell 2008, a retrospective correlation quantitative design measures the degree of association between 2 or more variables using a statistical procedure. Logistic regression is used to classify individuals into groups. As an extension of multiple regression, logistic regression allows for a categorical dependent variable. The independent variable of this study is the PN Comprehensive Predictor Examination Percentage Score, and the dependent variable is the NCLEX PN result, pass-fail. The study was comprised of students' data collected from January 2010 to December 2012 from a large proprietary school of nursing that has 13 practical nursing education programs in both urban and rural settings. The possible study population was 1,738. Each campus-based program follows the same curriculum. Graduates that did not have complete data sets were excluded. Complete data sets for 1,668 graduates were found and used for this study. The 13 campus-based practical nursing education programs are located in various cities across the United States. The campus locations were coded by a letter and were not disclosed to the researcher. The only demographic variable included in this study was age, represented by a numerical value at the time of admission to the program. The collected demographic was not used for the purpose of this study, but was collected for evaluation to determine if a trend emerged for future research. The numeric value for the age was missing in the majority of the campuses, so a trend did not emerge. Gender, race, ethnicity, GPA, admission criteria, and prior academic experience were not gathered. The National Director of Nursing was asked to place the requested data on the Excel spreadsheet that was provided. The National Director of Nursing assigned this duty to a designee, and the designee was also trained by this researcher. A letter, A through M, was placed to denote the campus location, so it was unknown. A numerical value was placed on the spreadsheet to represent the graduate. Incomplete data sets were verified by the National Director of Nursing before exclusion decisions were made. Of the 1,668 graduates, 1,411 passed and had a PN comprehensive predictor score between 22.67% to 89.33%. 257 students failed the NCLEX PN, and of those that failed, their PN comprehensive predictor score was between 40% and 86%. Data was collected from the 13 campuses, and a summary of each campus was also detailed. The average score on the PN Comprehensive Predictor Examination for successful graduates was 70.44%, and the average score for those that failed was 64.08%. SPSS was utilized to perform the logistic regression to measure the relationship between the independent variable, PN Comprehensive Predictor Score, and the dependent variable, the first attempt NCLEX PN result. The PN Comprehensive Predictor Examination score was entered as a percentage score, and the dependent variable, first attempt NCLEX PN result, and nominal data was entered as pass, coded as 1, or fail, coded as 0. The Omnibus test for model coefficient, the variable PN Comprehensive Predictor Examination results were added to SPSS, and when the Omnibus test of model coefficient gives a chi-square of 140.293 on a 1 degree of freedom and was significant beyond the p-value of less than 0.05 to test the null hypothesis. The stat block and model results were identical due to the single variable of the PN Comprehensive Predictor. Adding the variable to the model did not significantly increase the ability to predict the NCLEX PN results. The overall accuracy of the findings with logistic regression, it was 99.5% accurate in predicting success and 6.6% accurate in predicting failure, for an overall accuracy of 85.2%. So the variable PN Comprehensive Predictor Examination did not significantly increase the ability to predict the pass-fail results of the NCLEX PN examination. Discriminant analysis was also completed to determine the accuracy of the cut score. ATI has identified a cut score on the PN comprehensive predictor of 66.7 to 68% for a predicted 88% to 90% probability of passing the NCLEX PN. An analysis of the data incorporating the cut score predicted that a total of 498 graduates would fail and 1,170 graduates would pass. The results were 76.4% accurate in predicting success and 23.6% accurate in predicting failure. The cross-tabulation illustrates the relationship between the ranges of the observed score and the actual results on the NCLEX PN. A score of 66%, as determined by ATI, is the recommended score to have for an 88% probability of passing NCLEX PN. The probability was observed as correct for all graduates who had scores above 66%, except at the 80 to 86% level, which had an 85.6% passing rate. It was noted that the 5 graduates with scores between 22.67% and 35.33% passed. These outliers cannot be explained by the collected data. It was determined that the variable PN comprehensive predictor examination did not significantly increase the ability to predict the results of the NCLEX PN exam. As the findings relate to the literature review, as Haas, Nugent, and Rule found statistical correlation related to the nursing cumulative GPA and noted that successful candidates had a GPA 0.3 points higher than those who had failed, and Daly, Kirkpatrick, Fraser, Chung, and Moser identified 2 factors that led to success: the final course grade for senior level med-surg and the cumulative GPA. Ukera, Magnumus, Atano, and Zan identified significant correlation between nursing GPA and course grades in the fundamental course, and so on. No use of standardized examinations were noted in their results. The results of this study indicate that the inclusion of end of nursing education program comprehensive predictor examinations would provide additional information regarding the graduate's ability to successfully pass the NCLEX PN examination on their first attempt. In review of the literature for those that used a multifaceted approach, including standardized examinations, the findings of this study imply that the use of comprehensive predictor examinations at the end of the nursing education program will inform the graduate regarding a preparation plan for NCLEX PN examination success. The results of this study imply that the use of predictor examinations near the conclusion of the nursing education program should be included with the multifaceted approach. Identification of within-program predictors should be incorporated with that multifaceted approach. The use of predictor examinations will also identify those who are likely to fail the NCLEX PN and allow for creation of remediation plans. The study identified there's a greater ability to accurately predict success, but a weak correlation to the ability to predict failure. The findings of this research study inform practical nursing programs that the use of the end-of-program predictor examinations combined with various strategies will lead to increased first-attempt pass rates. The limitations for this study is that there is limited generalizability. Subjects were all graduates from one large proprietary educational institution. Though the campuses were located in various geographical areas, the admission criteria and course sequencing were consistent, limiting the ability to generalize the results to other practical nursing programs. It is possible that one or more individual campuses implemented additional or different interventions to promote NCLEX PN success that were not sanctioned by the administration of the School of Nursing. Based on the results on the PN Comprehensive Predictor, graduates may have changed their behavior and were motivated to engage in additional study before they completed the licensure examination. The National Council of State Boards of Nursing reviews and has an opportunity to change the NCLEX PN's passing standard every 3 years. The passing standard was not changed during the years of the study, but was increased for the 2010 testing season. The change may have impacted the passing rates and altered the predictability of the PN Comprehensive Predictor. The increase in the passing standard may not have been addressed in the PN Comprehensive Predictor. Future research should be completed at additional educational institutions that prepare licensed practical nurses to determine generalizability of the study. Also, the study should be replicated for the year 2013 and 2014 to determine if the change in the passing standard results in a change in the accuracy of using the PN Comprehensive Predictor. Future research should also be conducted to determine the effectiveness of other standardized examinations and those predictor exams. A comparison study would determine if one product had superior results and if the groups were similar in location and size. Additional studies should be performed to determine if standardized examinations that occur throughout the educational program help identify students that are at risk for failure. Also, additional research could be conducted to determine other factors such as demographics, admission variables, and grade point average. It was noted that the 5 graduates with PN Comprehensive Predictor examination scores in the range of 22.67% to 35.33% passed the NCLEX PN. The intent of this study was not able to determine the reason for the extremely low scores. Future research could be completed to include interviews of the participants to determine if the predictor scores were due to computer error, apathy, illness, or other factors. In summary, practical nursing education programs should not rely solely on the PN Comprehensive Predictor examination to identify the graduate's ability to successfully pass or fail the NCLEX PN examination. Reference slides are available. Thank you for viewing my presentation.